Hi guys, it's Cynthia Stelty. Just reporting in on day 3, if you include my surgery day. As all of you know, I had a septoplasty. Septoplasty is where they fix your nose when it was broken or crooked. In my case, both. I had a deviated septum to the left, so they had to break it and straighten it, and it all kind of started earlier this year in February when I was having horrible nosebleeds lasting weeks at a time, and it was pretty bad. A few scares here and there, but I am all better now. I had surgery on Wednesday at 7:30 in the morning. Today is now Friday, and I am feeling great. My throat is still a little bit sore, but more or less just kind of lumpy from all the dry scratchiness, and I've been gargling salt water to heal it, so it feels like it's healing, but at the same time it feels very kind of lumpy, I guess, like there's a lump in my throat. So yesterday I talked about day 2 and all the medications that I was taking and what would help with the swelling. Well, as you can see today, I have some more swelling right underneath the eyes, but that's okay. That's expected, and so you just make the most of it, and we will get through this together. So I'm going to show you a few tips and tricks if you do have surgery like mine. If you decide to have septoplasty, or if you have to have a septoplasty because you have nosebleeds, or in my case, if you can't breathe. I don't really have any old pictures to add in here, but my nostrils before were completely clamped shut. I actually didn't quite have much nostril to breathe out of, but I could partially breathe out of my right nostril. And as of today, and even yesterday, I was able to breathe for the first time all year out of my left nostril. And it feels so good. And my doctor didn't use any packing, which is amazing because there was no pressure. And I did not have to worry about going back and having this nasty packing removed. If you've watched other people's vlogs, you can see it looks a little painful. I don't have that in my nose. No stents, basically lots of grafting, and just very, very lots of technical details on my doctor's part. As I mentioned before, I used a doctor out of Tampa Bay who was double board certified ear, nose, throat plastic surgeon. So I went with him, and he didn't take my insurance, but that's okay because my original ENT did take my insurance, and she offered to do the surgery for me, but I felt that the price was just extremely too high, and so I went with a doctor who was a little bit more experienced, and the price was actually lower, and if I send it into my insurance, I'm sure that they'll cover a portion of it because it was for functional purposes. My surgery was needed desperately for my own health sakes. I couldn't really breathe all the time. Sometimes I'd wake up in the middle of the night gasping for air. Breathe Right strips only work for so long, people, but it needed to be done, so it got done. But without further ado, I'm gonna get into how to clean this up, just show you real quick how I do it, and what I've been doing about this purple beautiful eyeshadow. We'll call it eyeshadow. Alright, so yesterday I told you about this Arn Care gel. I've been applying it around my eyes, but you don't want to get it in your eyes because it will burn, believe me. And also the tablets. take the tablets 2 every 6 hours. I've been taking them. I actually started taking the Arnicare tablets a few days before my surgery, as well as an autoimmune a booster, a vitamin C you want to take. I believe it's 3,000 mcgs a day. I would say 2 weeks before your surgery, and keep taking those throughout your surgery. I mean, throughout your recovery. You will be out during surgery, so more than likely under general anesthesia, and you won't feel a thing. In fact, the last thing I remember feeling before I was put out was the coldness from the IV to put me to sleep. And it was a very weird feeling too, but once I was asleep, I didn't feel a thing, and the nurse was so sweet. She stood by my side, or sat by my side, until I woke up on my own, and I felt fine when I woke up. I was just kind of loopy, but not nauseous. Actually, my doctor believes in using a suppository so for the nausea, because you don't want to mix too much in with your anesthesia, with also the fact that you're going to be on pain pills and Arnicare tablets, and probably an antibiotic, because you're going to need to take that twice a day too. I take mine every morning and every night. So when it comes to the sore throats, as I said yesterday, biotin gel, squirt a little bit of this on the roof of your top of your roof when you wake up. And as far as cleaning your stitches and inside your nose, you're going to be giving ointment. Your doctor is probably going to prescribe you some of this, but before you put this in, I suggest that you actually use a little bit of rubbing alcohol on a Q-tip, and just take your Q-tip and just go only around the outside. Don't go inside the nose, because you don't want to mess up anything. You don't want to risk popping a stitch or anything like that. So just only go around the very tip of your nose, and then apply a good amount of this ointment afterwards. Some of you might have some questions, and if you do, feel free to ask me. I'm still a little new at this YouTube thing, but I really wanted to do these vlogs because other people had done vlogs and I watched them, and it helped my anxiety. It helped me really know what to expect when going into this surgery. I do want to say that be careful of who you choose to do your nose. I wouldn't have just any plastic surgeon. If you're getting it done just for cosmetic purposes, then that's one thing, but I didn't get mine done for cosmetic purposes. I got mine done because I needed to be able to breathe out of my nose without having nosebleeds, or just to be able to breathe again feels so much better. But even if you are going for cosmetic surgery, I would strongly suggest that you find yourself a double board certified in doing ear, nose, throat, as well as plastic surgery, because I've seen a lot of people who come out with a beautiful nose and then they can't partially breathe out of it, or they have some stuffiness, or they have other issues. And I feel at ease that I found a very good doctor who was able to just take care of all of that for me, and I am grateful that I found him. And I'm sure there are many more out there, so I'm sure if you Google someone who's double board certified as an ENT and plastic surgeon, you can find them. They are out there. And if the cost is a little higher because of it, then you're getting what you pay for. And this is your nose you're talking about, so money shouldn't be an issue. Luckily, my doctor has his own business out of a med spa, so he kind of just has a flat rate, which is wonderful. I paid right around $8,000, but my insurance will cover most of that. The medications were all generic, so out of pocket, it was under $90. Probably even less than that with my insurance. But everything else I just bought on Amazon, so you can do that too. The bruising, it's gotten a little worse since yesterday, but it's only around the eyes. You see, it's gone down a little bit right here and right here, but it's kind of like starting to form a little bit of an eyeliner. And I think the only reason that is because I haven't really been putting the Arnicare gel right on top of my eyelid, because I don't want to get it in my eye. But I have nostrils now, which is wonderful, because I didn't have nostrils before. They were completely collapsed shut. So it feels good to be able to breathe, and I am very, very happy. On a scale from 1 to 10, I would say the pain is at a 1, and at the most it had been maybe at a 3 at the most, and that's only because of the soreness in the throat. So if you can get the soreness in your throat under control, great. I couldn't eat or drink anything the day of my surgery, the morning of my surgery, so that didn't help a whole lot. So now I'm just drinking lots and gargling with lots of warm water with sea salt in it. Alright, so that's really all for today. Tomorrow we'll do another vlog and see if there's any swelling, see if the bruising goes down a little bit. So this is only day 3, and I get my splint off on the 8th day. So I'm looking forward to that. Having a nice straight nose. It's been a long time coming. But if you have any questions, feel free to ask, and I will try to get back to you. Alright? Have a good day, y'all. Bye.